Good morning, everyone, and welcome today to another Riverside Talk. Today's topic is a unique approach to substance use care and recovery. Before we begin our program and introduce you to our speakers today, I'd like to just thank my team, Jason Latour, who is our media production manager, who is our producer of this program, Nancy Nabi, our community liaison, who helps connect us with all of the organizations in our community, and Candace Cousins-Hopkins, our Associate Director of External Affairs, who just does everything else to make this come alive. So today's program, we have a couple of speakers. We did have a change in our lineup today. So we have Eileen Campbell, who is our Associate Vice President for Behavioral Health Services, and John Slotwinski, our Senior Director of Clinical Counseling, Training, and Development. I should also add that my name is Denise Mananis, and I am the AVP for External Affairs for St. John's, and I usually act as the host. Before we go any further, I do want to tell our audience that we are willing to have you put questions for our speakers into our Q&A. And at the end of the program, if any of those questions have not been addressed, we will be happy to ask the questions for you. So make sure you get them into the Q&A. Also, we have some wonderful community organizations that we work with to help us get the word out about these programs. Yonkers Neighborhood Naturally Occurring Retirement Community and the Yonkers Public Library are our two original partners, and they've done just a wonderful job at getting the community to support these webinars. Also, though, joining us is the Ashling Irish Community and Cultural Center, the Department of Veteran Services for the City of Yonkers, the Ardsley Parks and Recreation, Ardsley Senior Center, the Bronxville Community Center, the City of Yonkers, the Yonkers Community Baptist Church, Hastings Community Center, Irvington Community Center, Westchester Jewish Community Services, and Yonkers Pathways to Success. So we have to thank Nancy Nabi for that. She's the one who goes and connects to all of these wonderful groups and has them join us for these programs. So without further ado, I would like to get our program started. Eileen Campbell, who is our first speaker, is the Associate Vice President of Behavioral Health at St. John's, and that is actually located in our Park Care Pavilion. She is a healthcare leader with more than 3 decades of experience transforming organizational cultures to meet the demands of today's healthcare environment. Eileen served as an ICU and medical surgical nurse, in addition to working with Fortune 500 healthcare organizations for over a decade. This dual experience in business and healthcare informs her efforts to help leaders, physicians, and nurses deliver better service and business outcomes to achieve operational excellence. And I can actually vouch for all of that because she's terrific and wonderful and is doing a great job. John Slotwinski, who is graciously stepped in for our other speakers today, is currently the Senior Director of Clinical Counseling, Training, and Development at the Park Care Pavilion. John has been a licensed clinical social worker since 1981, and prior to his current role, John has been the director of the New Focus Outpatient Clinic at Park Care. He also has experience at the United Hospital Outpatient Services, the Mental Health Association of Rockland County Children and Adolescent Services, and was also the Director of Counseling Services for the United Hospital Inpatient Acute Care Psychiatric Unit. John is considered a legend in the clinical counseling community, a renowned go-to expert in the social work field, and we are happy that he can join us today. So I welcome you both to our program.
Thank you.
So to begin, what I'd like to start with is just a brief statement that, what we're seeing in our communities is just a crazy amount of substance use. It doesn't matter where in society people are, wealthy, middle class, poor, it's hitting everyone. Color is not a thing that it doesn't play favorites with any particular group. It's not a man's thing, it's not a woman's thing, it's an everybody thing. And so with that, and we know with all the media attention on the changes in the drugs and fentanyl and all kinds of things, that this really is something that people need to be aware of. What do we offer that makes us unique? in this quest to treat and help people who have these substance use issues. So with that, I want to start with Eileen. And so what I'd like to ask is, St. John's Park Care Pavilion, where our behavioral health inpatient is located, and some of our outpatient is located, has a long history. So can you talk a little bit about the history of the service in this field?
Yes, absolutely. St. John's has been in the mission to serve our community for over 150 years. And importantly, about more than 4 decades ago, the community began to change and there were needs for substance use disorder treatment. St. John's immediately responded to the needs of the community and began services right here at the Park Care Pavilion. And we have grown full force from that time to one of the largest programs in Westchester County. We currently treat 72 inpatient detox beds. We have 69 inpatient rehab beds. We're one of the largest in Westchester County. Our commitment is here to serve our community and to serve our patients. And to your point, Denise, this has been an ever-changing landscape with regards to substance use disorder. And most importantly, following COVID, we saw a significant change in our landscape yet again. And St. John's Park Care has been moving, and we're excited to tell you all about what we've been doing after the pandemic to meet the new needs, because quite honestly, what we were doing before the pandemic is no longer appropriate for what we're doing right now. We are seeing in our community that people are coming in with alcohol use disorder, with opioids. We're seeing cocaine, we're seeing heroin, we're seeing fentanyl present in almost any of the substances. And as you know, fentanyl is so much more addictive. And those result in challenges that we're seeing because of those issues. Additionally, what we're seeing new and different here is that our patient population is older. We're seeing that we average around 45 years old and older. And what that means is a lot of our patients now have comorbidities. They have medical problems in addition to the substance use issue. So whereas in the past, it may have been a focus on, hey, let's manage these substance use issues. Now it's become a much more comprehensive approach to how do we help people with their other medical issues, things like hypertension and diabetes. So that is what we do so beautifully. St. John's is a hospital-based program, which means we're medically managed. And what that means is that we can provide the same level of medical care here for a patient going through detox as a hospital can. And that positions us really well for the new clientele that we're seeing come through here. We can do things from a nursing perspective. Our building is staffed with probably 90% registered nurses, right? And we're able to do the same kinds of procedures over here at our Park Care Pavilion that we can over at our main building. And then of course we have the opportunity to move our patients from one building to the other as their acuity needs move.
So that's very interesting. So the let's stay on inpatient. So
sure.
What is the process? I know that even in my tenure, because I do have staff that work for me that are participatory in this process of bringing people into care. And but I know that even in my tenure, things have changed in how we're welcoming people into the building, how we assess them. Can you kind of walk through what the process is?
Yes. So many people know somebody in your family or your friends that have been affected by substance use disorder, and there have been stigmas in society. Post-COVID, we're seeing that those have changed, which is a good thing. What we create in this culture here is one of respect and kindness. It's our primary credo. So we know that when people have the courage to come here, and that's not an easy decision to do that, you know there's going to be some hard work here. So we know when they come in, it's our obligation to have a very judgment-free zone and to be very respectful and to be very kind. So on intake, we have a very personalized touch. Patients will come in, they're immediately greeted. They are spoken to, communicated through the entire process of what we're about to do. We ensure dignity at every aspect of the process. We describe everything we're going to do. We provide options if you prefer to interact with a male or a female. We do everything to make it possible for our patients to be able to commit to their future health. We've redesigned our, we call it the Patient Welcome Center, and we do mean that. We welcome our patients to come here. We're here to help you. And it's designed in a fashion that provides confidentiality. We have individual, very comfortable reclining chairs. So when the patients come in with curtains, with iPads, we want to be very respectful of the patient and the process that they're going through.
So let's talk about their time in the Patient Welcome Center. There is obviously, they come in, they have to go through the registration and all of that, and then they're made comfortable. So what happens then? There's a clinical assessment that has to happen to determine whether someone needs detox or rehab or a different level of care.
Mm-hmm.
Is that a fair statement?
Yes, and we've actually even expanded that. So when a patient comes through for admission, they'll meet 3 different disciplines here. They will meet now with an LCSW, so a licensed social worker. They'll meet with a registered nurse, and they'll meet with a medical provider in the Patient Welcome Center. And everybody's looking at it from very different perspectives, right? So we're looking to make sure behaviorally the patient is okay. You know, this is the right spot for them. We want to understand and identify what their goals are. We also want to understand medically, what are you here for? How do we best help you? So the medical assessment is done. It's determined whether the patient is appropriate for services, and if they are they appropriate for detox services or rehab services? And if not, how do we safely get them to the next place of care? Right, and that's what our LCSW team helps with as well. We have registered nurses also on admission in our PWC, Patient Welcome Center, and what they do is they're assessing the entire person to make sure, talk about their health history, medications, anything that may impact their care.
Okay, that sounds great. So moving through that process, they're admitted. Now let's talk briefly about what happens on the detox floor, what happens in rehab from an inpatient perspective. You get upstairs, you tell me what happens in detox.
So the patient will come upstairs. They'll immediately be greeted by a member of our team. It could be nursing, it could be counseling or provider, and they will they'll be acclimated to the unit. They'll be oriented to the process. Initially, in the first 1 to 2 days, it's a tougher couple of days for them. We tend to deliver more of our services at the bedside. Once again, we are a medical model facility, and support the patient's needs. They will meet with a counselor at this point to talk about everything that they're feeling. How do we help them to sustain their original commitment? We identify what's their why are they here, so that we can help them throughout their next 4 to 5 days of their treatment. And they'll be receiving medication to make it easier as their body physically detoxes from whatever the substance is that they're using.
Okay.
They'll meet, the nurses are here obviously 24/7. We do work on a medical model once again, so we have a fair number of nurses here. Providers are here 24/7 for patients, and counseling services are here as well every day to support the needs of the patient.
So in detox, once they get kind of over that initial hump, and as you say, they're being medically managed, do we have peer counseling? Do we have other kinds of counseling that go on so that they can kind of get their feet wet in that process? Is that what's going on?
Yes, we do. Thank you. Yes, we do. There are groups that occur in detox as well as rehab. In detox, our groups are led by nurses and by our counseling team as well. The goal is to engage our patients as frequently as we can. Additionally, St. John's also offers something called milieus. Those are aids to counselors for increased levels of engagement with our patients. Those are people that will have pop-up activities, conversations, a card game, things of that nature. But our patients will always have the opportunity to engage based upon their where they are in the detox process.
And so then once they've completed detox and they move over to rehab, can you give us an idea of what that stay is like and what goes on there?
So on average, for most of our patients, they'll stay an additional 2 weeks. And that's where our counseling team really does a lot of the heavy lifting. They work with the patients to identify patterns of the past that have not been successful in terms of coping and self-soothing. They do a lot of deep diving. They do a lot of introspective. This is where a lot of the hard work goes on with their thought processes and what they're doing. Groups are extensive. I think we do about 7 a day. It's constant. It's constant interaction. We give the patients a lot of the controls. We make them leaders. We get them involved in their community. We do mimic, life when they leave here, and those responsibilities in terms of, ADLs and
Right.
all of that is for their own.
Right. So basically, rehab is preparing them for the next transition as well.
Correct.
And can you mention I know we have a rec center and the activities that are part of that?
Sure. So patients are also attend our recreation center. So in there we have all kinds of different things. Karaoke. You should hear the singing that goes on. But people have beautiful voices. We have phenomenal artwork in the building. Yeah. We have 2 recreational therapists that we employ here to be able to engage the patients with their other strengths, right? And so we help them to understand what, and to further develop the things they're really good at. There's ping pong table, there's foosball, there's huge puzzles all on the table so that people can just engage and talk, checkers, chess, lots of opportunities for patients to engage and socialize in a way that's therapeutic with less pressure.
That's great. But I do want to talk to our other guest, John, a little bit about the counseling aspect, inpatient, and then we'll talk next about outpatient services, both at Park Care and offsite. But first, can we talk about the role the counselor plays, John, and what that model looks like now, and how far it's come, because I know it's come a long way.
It certainly has. First of all, I wanted to add that the counselor after the medical stuff happens, that is the medication piece, they have a lot of work to do with the patients. Our patients have very debilitated neurochemistry. That is, they have remarkably challenged, compromised ability to self-soothe. They really can't. They've been taking enormously, very, very strong substances. And the fentanyl that's almost everywhere when the people come in now, just to remind people, it's grain for grain, it's probably 100 times stronger than basic heroin, or
Wow.
morphine rather. Yes, it only takes 2 or 3 grains for fatality. So this is how strong this stuff is. So it hijacks the neurochemistry tremendously. When the patients go into rehab, they're starting to say, okay, how do I live without this substance? How do I self-soothe? How can I live without feeling like I'm jumping out of my skin, literally? So they have a big job. On top of that, they also have co-occurring disorders. I looked at our inpatient. Actually, 66% of our patients going into inpatient have co-occurring psychiatric disorders, a full 66%.
Wow.
Also trauma related. So our counselors have to be able to handle co-occurring disorders along with addiction, as well as trauma-based, trauma-generated behaviors. And that, for example, this is right from our data, our own database, 58% of our patients going into inpatient have experienced significant trauma. I'm talking about trauma like sexual abuse, being beaten in jail. Some of them have been going to jail since they were like 15, 16 years old and experienced horrible consequences from that.
So
and they
counselors have their work cut out for them.
They certainly do. So it's required a lot more training than years ago, a lot more. So the training for counseling has been has been ramped up tremendously.
Very interesting. So give me an idea of what happens with the counselors.
Okay.
They need to what's their activity look like?
First of all, we use a lot of manualized approaches, exactly, that are combined with good group work treatment. That is, patients come in, we tell them, listen, together, we're stronger than any one of us alone. Okay, and we try to get them to help each other in the group process, to develop the countermeasures to what they're going to be feeling. We try to sometimes inoculate them, saying, you're going to be feeling something. This is a part of your recovery. This is a part of the disease. It's not going to catch you off guard. Okay, this is what's going to happen, and this is what you can do. Okay, to counteract that. All right. So a lot of it we use motivational enhancement therapy. That is, our patients have some of them been in jails, or they're motivated by internal feelings of discomfort, or external feelings. Okay, we try to develop the internal feelings of control. Okay,
Right.
That's why a lot of patients, they go to jail. They're going to jail for 3 years, 5 years. They come out, and then guess what? They go right back into it, even though they may not have used for 5 years, because they've never developed that internal locus of control, which is extremely important. Yes.
Right. So, but John, I know you're talking about a specific set of clients that and patients, but we have people who present from people who own their own businesses, people who are,
Absolutely.
middle class, right?
Yeah.
People who are working professionals, and they are functioning on some level in society, but they come in because now they've reached a place where they can't function at that moment. So when you're talking to them, you're talking to that's a slightly different, because those people don't tend to necessarily have trauma that's as evident as perhaps some of the other patients that we're talking about. How do you get them to get to that place? I want to kind of get in the grass here, in the weeds here. How do you get them to understand what has prompted them? Are they still suffering from that same lack of focus that the other clients that you're describing?
And these folks often are invisible. They go through the feeling not noticed until horrible things are happening. They lose their family, they lose relationship with their children, they're in job jeopardy, and they're just feeling horrible about themselves. So we try to intervene with them, again, as early as possible by community education, so that people understand the early signs, for these folks when they come in. And when they come in, a lot of the treatment they get is not that different than the basic substance abuse treatment that anybody else in the community gets.
Right.
Okay.
So they are involved in looking at their own lives, their own behaviors, maybe their own triggers.
That's exactly what it is.
Okay.
Yep, that's exactly what it is.
It's all a lot of hard work.
Also the consequences, because they're not aware. Very often they come in and they compartmentalize the consequences of their use, both for them and from their families. At some point when they understand the consequences, it becomes that becomes motivation for them to stop. They stop basically for themselves, but they also stop because they want to be better parents. They want to be better people in life. They want to be better partners and spouses. So it's when that all comes in, that we kind of harness and develop the motivation for continued treatment. And as you said, to recognize and respond to triggers or dangerous places for them to be in. Okay, but the triggers are extremely important.
And I think that's the important piece here, is to say it everybody presents here, right, with the symptom of a substance use. And then what ends up happening is everybody has to go through the work to figure out why they're self-soothing, right? And it honestly, in the end, it doesn't matter, where you came from. to your point, you know, we treat a lot of people who are professionals here as well.
We do.
And what ends up happening is there's something they have to work through. And that's what our counseling team does so brilliantly, is really helping to bring them through something that's been so painful that they have been doing this soothing and medicating, and to help them to get to the other side so that they will be successful in their sobriety.
And you know, their hope, they're when they sit in a group, if they're sitting with other people from all different places, they have the same sense of hopelessness.
Yes.
And our job is to give them hope. And they walk in, you know, whether have a lot of bravado and deep down they feel less than, deep down they're very short on this thing called hope. And a lot of the counselor's job is, in fact, to help them to gain some hope that things can change, okay? Because many of them deep down do not believe they can change, okay?
So you guys are all doing a really incredible, you know, work for people's lives. I mean, it's so much bigger than what we're really talking about. So let's take that and segue that into outpatient, that transition.
Denise, before you go there, I just want to add in one thing because it's the perfect segue. Yesterday, we had a patient in our rehab services. He had gone through our detox program and our rehab program, and he came to present to our team to share with us what his experience was.
Wow.
And it was incredibly touching, because he talked about what John said, the hopelessness, that I've given up on myself. I'm never going to be able to do it. It doesn't make any sense. But he reached out to us, and you talked about this before about peer advocates. We have a peer advocate who we reached out to, who is a person who actually had come through our program as well on their path to sobriety. They reached out, they made that connection. The patient came in and he stood in front of us and said, I was the person who just didn't believe in myself. I never spoke. He said, if you told me that I'd be in front of this room right now speaking to 25 people, I wouldn't have believed it. But I'm learning to believe in myself. He said, I am the team lead out on the floor now. I walked by, I was on the floor this morning. He's leading the group session. So those are the kinds of transformations that we're seeing. There's a bunch of ingredients that we use here, but in the end, he has shifted. And we do things like that every now and then because we want to empower the team. We want them to remember all the good things they do so we can go back and do it for the next person and the next person and the next person. But that was I think that brings it all together, all
That's
the work
wonderful.
that we do. Yeah, that was a great story.
That was a great example of moving from hopelessness to the beginnings, the sparks of hope, which now will be built upon, which was wonderful, actually.
That's beautiful.
Yeah.
So can we now, so that's a wonderful bridge because that story is so moving and wonderful. And now people have to go back out into their lives and maintain that. And so we do offer a number of programs from an outpatient basis. A few of them are at Park Care. Some of them are off-site. Eileen, can you just walk us through what the programs are?
Sure.
And
We have several programs. So we have New Focus, which is right here in Yonkers. It's in our building right here. And if a patient is from our community, we'll refer them right over there. They will receive outpatient services where they will engage either in a day rehab program or in a clinic program where they stop in. And it's all determined by the counselor and the patient. How many times do they need to come in? What's best for them to sustain what they've already achieved? And we do, John, you could probably speak to New Focus as well as the other ones as John ran them as well. But what we want to do is we want to sustain the success that they've had. We know it's hard. When you get out of here, it's hard. You don't have those same support systems. So we provide them in our outpatient programming to be able to make sure that our patients can sustain it.
And I have to say, along with this, one of the unique things about our behavioral health system, and it's very unique, we have a full continuum of care under one roof. They can start in detox, they go to rehab, they'll go down to outpatient, they can go to our opioid treatment program, methadone, and we refer them upstairs to Hope Center for primary care, as well as if they have Hep C or HIV. Everything is done here. It's just a matter of getting in an elevator and going to a different floor. And sometimes when we refer our patient like across town to a doctor, you might as well be referring them to the other side because they don't make it. But when we take them by the hand, especially in early recovery, when they're still shaky in terms of their motivation, we take them by the hand and we'll bring them to the service that we need. And we can communicate, all the services communicate with each other. So we have a non-fragmented continuum of service and care, which is really best practice by far.
That's wonderful.
And the new thing, if I may interject, we've just started, this is once again a post-COVID change. We want to make sure that we're here for our community. Many people will not present to Park Care. They may be going, patients who have issues may be going to general hospitals, for example, like St. John's Hospital. We have just created a program where there is now a bridge. If anybody comes to our hospital, our emergency department, we have now an inherent system in place so that they will be referred to us so that we're able to help them with any challenges that the patient may have. So we are now looking at all of patients' issues as they come to our system, and we have the appropriate referral sources over to behavioral health as well.
Yeah,
That's
and
awesome.
medical,
Which is really exciting.
And every day our patients are notorious for not taking care of themselves in terms of their physical health. Horrible situations. They come into our patient welcome center. We get them right over to our medical, take care of them, and they send them right back. So it's really, it's really over the years have developed a well coordinated system of healthcare, whole person healthcare.
And John, I want to tap into that, the holistic approach, right? So the substance use is what they present with, but to John's point, we are very serious in committing to supporting their total health. The gentleman I referred to that popped in yesterday also said, you know what, for the first time, I'm learning to control my sugars and I'm learning to control my blood pressure. So we have coordinated with him a visit to see his primary care doctor. So once you start to fix one portion of your health, our approach is the holistic approach to that patient. So and of course, we are also supported with specialty services in our system. So we can refer people to our endocrinologist, to our cardiologist. So we give them all the support physically. And I also like to add in that we also do spiritual support as well. As you're going through this journey, this is a tough journey and lots of things come up, as John has mentioned, in your mind. And one of them is their spiritual needs. We also support the spiritual needs of our patients with a reverend that comes here and speaks. As a matter of fact, this morning as I was walking by, he's in the same room with the man from yesterday. And there is so much that the patients gain from this, right? So even though you come here for substance use, we provide all the services that they need for their total healing and their total success.
I know which reverend you're talking about. It's our fabulous chaplain. That's our fabulous Reverend Paul.
Yeah, he's wonderful.
He is amazing. He's amazing. Okay, so you mentioned the outpatient programs that are in Park Care, but we do have some others. Can you just tell our audience where they are, what they do, and the spectrum of clients that they see? Because I know that there's a couple of tracks.
Would you like to, Eileen, would you like me to take that?
Sure, John.
Okay. You know, we have a full outpatient clinic in Greenberg. Okay, and they also offer dual diagnosis treatment as well as across the board treatment, and are connected to all of our services here at Park Care. They're totally connected with Park Care and all of the resources that we have here. Okay, and they also have an adolescent program that works with one of the group homes nearby, and these are kids who are really debilitated. I mean, they've had horrible lives. They're throwaway kids, adolescents who have no. One of the kids, they were talking about parents, and one of the kids said, I don't have parents. She said, I have staff. Okay, that's where her whole life was. Those were her parents. I have staff. Archway, we've also entered into the same situation. We have a full service, a full outpatient clinic there. And
that's in Mount Vernon.
That's in Mount Vernon, which is interesting because that's one of the places I hear advertised all the time with the cannabis dispensary that opens up, that delivers door to door. Okay, and they have a terrible adolescent problem of weed smoking there in the schools, and they wind up in the adolescent court, actually. And we have now an agreement with the adolescent court. Kids who are referred there from the schools, they actually are coming to Archway, where they'll be treated for, like, we're talking daily cannabis use.
Wow.
Okay, it's so frequent with the non-criminalization of cannabis.
Yeah.
You know, nobody thinks anybody should be sitting in jail forever because of cannabis. However, it has to be noted that cannabis can really debilitate individuals, especially a young person whose brain is still forming. Okay.
You know, I just want to make a statement about that. I mean, there's a popular culture, media acceptance of the idea that a little pot, a lot of pot, it's not a big deal. It's not something that hurts you. Although anything that you smoke, I don't understand if cigarettes are bad for you, why this wouldn't be bad for you.
It is.
But right. But so the reality, can you just talk briefly about that reality that pot is something that, cannabis is something that is dangerous because it does open the door for other use? It
does. And what we're finding with cannabis, either, kids they may not buy it from the dispensary, they'll buy it on the street still because they'll buy it cheap. And it's very often cut with angel dust, unfortunately, PCP. And a lot of those kids wind up in the emergency rooms, actually, PCP, because PCP is a substance that's it's smoked. Okay, and it's a hallucinogen, but it's also not just PCP, but synthetic cannabis as well, which is cheap.
I've heard a lot about synthetic cannabis and what it does to the brain.
Yeah, it's so dangerous. It's a cannabinoid. It's similar to cannabis. It's a cannabinoid, but similar to regular cannabis. Okay. However, it can damage the brain. It can damage organs as well. There are cannabinoid receptors in the liver, in the kidneys, and it can do horrible damage to a young person. Also, when kids are smoking weed, again, that young brain is still forming actually, in terms of the neural pathways that are trying to still form. That goes on even into the early mid-20s. That it compromises those particular neural pathway, the forming of those neural pathways. It's just very sciencey type stuff, but it really is very important to note that it really can help. And kids in school, when they're high on pot, they're not concentrating on what's going on in the classroom, and they're getting in trouble. So with this agreement, we have with the town of Mount Vernon, they're going to be sending their kids who are getting from the schools who are getting in trouble with weed smoking, and we'll be able to treat them. I set up a particular manualized treatment program for them that I'm training the staff to use, and we'll be able to treat those kids for early intervention. And then embedded with that group are going to be some kids who have more serious problems, or some kids who are using in what's called a compensatory way to respond to a psychiatric issue that is not detected. So we'll be able to detect all of these other issues while they're in treatment with us. So it's a very important intervention, actually.
And I think what you can hear is that the landscape, as we mentioned earlier, it continues to change, right? And we continue to respond. One additional thing I'd like to discuss is our providers, our doctors. So to John's point, we have psychiatrists on staff. And we work with, even in our outpatient locations, right, where the program John was just discussing, we have our psychiatrists there, because early on, if there is a young person that's struggling with substances and there is a co-occurring disorder, we want to help them with that sooner than later. Right. So we provide all those resources. We have providers. We have our lead physicians here are board certified in addiction medicine. That speaks to the commitment we have to ensuring that we are on top of our game, providing the best practice, evidence-based practice to be able to help and to treat all of our patients, regardless if they're in our inpatient or outpatient sector. And really thrilling too is our newest provider is certified in mindfulness, and so we're doing an entire program so that we're able to bring that to the patients, so that we can help with some of the anxiety reducing techniques with yoga and with mindfulness.
Yeah, I think with those complementary treatments, I think will add a very important component to the medical treatment as well. It's my opinion. I've seen it done. I've seen it in different pockets here and there in the past, and I've always seen it work well.
So I just wanted to round out this discussion with one other question, which I think is a little bit futuristic, but not so far out in the future. I know that we are looking at programs that are virtual to help people who are employed or who have been mandated by an employer to participate. There's a greater degree of anonymity when you have a virtual program. Eileen, can you talk to what the thought about that is?
Sure, absolutely. We continue to figure out how do we serve our community. There are a lot of concerns out there with mental health, and how do we help to serve that community with the talent we have here? Quite honestly, these clinicians here, the counselors, are brilliant. And I don't believe I've mentioned it yet. They're not new. They've been doing this for years and years. I mean, you look at somebody like John, you introduced him as a legend. He is a legend. When we come into a room with our peers, people look at him, they look for what he has to say. Yeah. We've been doing this for a long time. The team is really good at it. So we're looking for a way to have easy access to people in our community who might not want to come in, who want to just call and have a session with a counselor in the privacy of their own home. That is, we'll be coming out with that relatively soon. But we continue to watch to see what's needed, and our commitment here is to support our community to do that. So we will be providing those telehealth services.
That's wonderful. And I do want to give a shameless plug to the start of the process, which are the gentlemen who work for me in outreach, who visit hospitals and social service agencies and other places, and are the means by which we get patients to come in. So we do provide that transportation service as part of that initial outreach. And these are people that have developed relationships with people in the community, and they understand these clients as well, these patients as well. You know, they're generally all from the same, you know, backgrounds where they've had to, you know, sort of overcome their own issues, and are extremely committed to helping people get into care. And so you might see them around, but they're wonderful. So that was my shameless plug for them.
Well, could I add to that plug?
Yes.
You know what? I'm very familiar with all of the services in this county and other areas as well. And I don't think there's any other facility that does this connection to treatment as well as you guys do it there, or they don't do it at all. We have extremely well developed. So the removal of barriers has been, you know, remarkable with the marketers. That's very, very important.
And I appreciate that. And I love that phrase, the removal of barriers, because I think, isn't that what we're trying to do from the beginning to the end of this whole process? So speaking of which, I think we might be out of time. And before I let our audience and let you two go, and I will give you the last word, I do want to let the audience know that we are planning a series of these webinars on behavioral health, taking different topics. The next one for the community, the general community, is going to be in September. And we're going to be talking about the difference that the right counselor and peer can make in the recovery process. And I think, you know, you can go back to Alcoholics Anonymous and your support person, and so it's a peer person who helps you. In that vein, that's what we're doing every day in our programs. And so we want to bring that in, and I'm hopeful that we're going to be able to bring in some, like, to your point, that gentleman who spoke yesterday, Eileen, I'd love to get him into a webinar about care and recovery
That's
as well.
great.
Yeah.
So, any last words that you'd like to share with our audience about the program before we do our end of program stuff?
Sure. Well, thank you everyone for being here. The most important takeaway is know that we're here. We're in the community. We offer the full spectrum of services, and we're here to support your friends, your family, your loved ones. It's what we do. We do it really well.
That's
And
great.
I would second everything that Eileen just said, and I really consider it a privilege to be working with a great group of professionals, committed professionals here. So
Eileen and John, thank you so much for being with us today. Anyone in our audience who has someone they know who needs support, this is our phone number to access help. Call the number 877, which is a toll-free number, 944-CARE. That's 877-944-CARE, or the direct dial 914-964-7537. Don't be shy. Even a phone call just to start the process is important. For those of our audience who may need medical care but are unsure or still have fears about going into medical establishments, please feel free to call our virtual urgent care, which is at 914-207-0006. They will make an appointment for you for virtual medical care, not to be confused with behavioral care. And then finally, if you have general questions about today's program, or you would like a physician referral or a referral into care, you can email us at info@riversidehealth.org or find a doc at riversidehealth.org. Both of those emails come to me, so I will make sure that they go to all the right people to get the information that you need. And obviously the phone numbers and our website are there for more information. We really appreciate our audience for being with us today, and especially for Eileen and John being with us today. You guys are wonderful. You know, you're doing great work. We really appreciate your time. Thank you.